Hello, everybody. My name is Chris Lieu, and I'm a GI medical oncologist at the University of Colorado Cancer Center. Thank you for taking the time today to talk about developing a personalized surveillance and prevention plan after completing all of your treatment for colorectal cancer. Okay, so now that we've talked about the testing strategies and even talked about circulating tumor DNA, what steps can you take to prevent a recurrence of colorectal cancer or to prevent the development of a new colorectal cancer? And so, what I always say is when we talk about cancer prevention, everything that we learned about in elementary school still applies, right? So, besides the surveillance test that we've already talked about, good diet and exercise is always the best thing to not only prevent cancer, but just to have the best health possible. And so, this is probably the biggest thing that you can do to prevent, obviously, not only colorectal cancer, but other cancers and diseases too. And there's going to be a lot that you'll read on the internet, and people will tell you about what diet you're supposed to follow or how much exercise you're supposed to get. But the simple answer is, if you have a diet that's kind of limited in terms of processed foods and red meats and higher in fruits and vegetables, then you're probably doing a really, really good job. It doesn't mean that you can't have a steak or a hot dog at some time, from time to time, but it's important just to keep things in moderation. And in terms of exercise, what we really recommend is 150 minutes of exercise at a minimum a week. And this really doesn't have to be running a marathon or anything like that. It can honestly just be getting your heart rate elevated for 20 to 30 minutes, kind of sustained, which means sometimes just taking a walk or going for a light jog or just doing something that's fun. And obviously this has significant physical benefits, but also mental benefits as well. What about aspirin and vitamin D? And so there are some studies looking at the use of aspirin to prevent polyp formation. There is a slight bleeding risk associated with aspirin, and I really encourage all patients to talk with their doctors about whether or not a baby aspirin on a daily basis is something that you should consider. There are studies to suggest that the use of aspirin after a diagnosis of colorectal cancer can be helpful, but this is something that I certainly want everybody to talk to their doctor about. What about vitamin D? Vitamin D deficiency is likely more prevalent in our patients and our society than we realize, and checking a vitamin D level in the body can help you know if you are vitamin D deficient. There are several studies in colorectal cancer that suggest better survival with higher or normal, at least normal levels of vitamin D in the body. But the true overall impact of vitamin D on cancer is currently not totally understood, and clinical trials are really helping us to determine what the true impact of vitamin D is. But of course, vitamin D is also not something that's really going to hurt you. And then finally, I do want to talk about tree nuts. This is kind of a funny thing to think about, but there was an observational study of 826 patients with stage 3 colon cancer. And in the patients that consumed 2 ounces or more of nuts per week, and so this is kind of like roughly 48 almonds or 36 cashews, if they consumed that many nuts per week, they actually had a 42% lower chance of colon cancer recurrence and a 57% lower chance of dying from colorectal cancer than those that did not eat nuts. So if you're somebody that can tolerate almonds or cashews, those can sometimes be a little bit harder to digest as well. But if you're not completely adverse to tree nuts, that's something that you can consider eating on a weekly basis, I guess. What are some other things that you should consider in the surveillance and prevention period for colorectal cancer? I'm going to tell you a little bit from my own experience that I've noticed. And I would tell you that many of my patients, and I would say particularly my younger patients, tell me that the most difficult time in their cancer journey was not during or after surgery, or even during chemotherapy or even radiation therapy. But they told me that the hardest time was actually after all of the treatment was completed. And so the reason for this there's probably a lot of reasons for this, but when you are undergoing surgery or you're receiving chemotherapy or radiation, the schedule is packed and there's a lot of visits and you're meeting with a lot of people and there's a tons of tests and procedures, and it's almost kind of like these marching orders that you're just kind of doing because you're in this fight against colorectal cancer. And you may literally see a healthcare provider literally on a weekly basis or even at least every 2 weeks. But when the treatment is over, a lot of my patients really find that they have a lot more time on their hands. And there's a lot of time to reflect, think, and even process just the pure insanity that you've been through. And so, even going through a surgery is really, really difficult. Going through chemotherapy or radiation alone are difficult. When you combine all three of those, it can be even harder. And so when you have all of this time to yourself, it can really be a period that's filled with a ton of emotions and feelings. It can be joy, and you can be ecstatic, but it can also be anxious and anger and grief. And in the meantime, there also are not a ton of people who really understand even a part of what you've gone through. And all of these emotions can happen very, very close together. And I think that it's also this situation can also be somewhat isolating at times. And I think taking the time to process what has happened is certainly critical. I've found that patients that meet with counselors or support groups or online groups or a combination of all three can really, really be helpful. And I always encourage people to really talk to their care team about what they're feeling and what they're processing, to not ignore that. For loved ones and caregivers to understand that even after all this treatment is completed, things don't necessarily automatically go back to normal. And I think it's really important for everybody to understand that, to seek care, to have people to talk to during this period. So I want people to be very, very aware of this. If you're going through it right now, definitely reach out and make sure that you're talking to somebody. So just to wrap up, some final thoughts. I think the key to ensuring the best treatment for cancer and the best chances of prevention for future cancer is just good communication with your cancer team, and having the right surveillance plan with the right lab tests and the right radiologic tests will lead to the best outcomes. Communication is certainly important because we talked about, we just want to make sure that we're addressing your needs, and that includes obviously physical, which we've addressed, but also psychological, emotional, and spiritual as well. And then finally, ask your doctor about any clinical trials that are available during this period of surveillance and prevention. These are often very easy studies to participate in. In other words, they're not very time intensive. They may give you access to exciting new ways to prevent or detect cancer, and can honestly lead to a healthier body, a healthier life, and a healthier lifestyle. So definitely ask your care team about that. Again, thank you for taking the time to talk about cancer surveillance and prevention, and I hope you guys have a wonderful day. Thank you.